Have you ever pondered the magnitude of discomfort that individuals with axial spondyloarthritis endure? The constant debilitating pain that resonates from the sacroiliac joint can be overwhelming, to say the least. Fortunately, the world of medical science constantly seeks new pathways to alleviate such discomfort and improve quality of life. Enter Dr. Ahmed Elsaman and his group, who have recently conducted a groundbreaking study examining the impact of steroid and lidocaine injection in the sacroiliac joint on patients suffering from axial spondyloarthritis. The study aimed to assess the effectiveness of this treatment on both clinical disease outcome measures and magnetic resonance imaging scores. The methodology of the study was as follows. Participants were randomly assigned into two groups. Group 1 received a unilateral ultrasound-guided sacroiliac joint injection with 0.5% lidocaine hydrochloride mixed with triamcinolone. On the other hand, Group 2 received a subcutaneous saline injection. It's worth noting that all participants met the Assessment of Spondyloarthritis International Society criteria for AxSpA and had bone marrow edema of at least one sacroiliac joint at baseline. The outcomes were measured using the Visual Analog Scale, Ankylosing Spondylitis Disease Activity Score, Bath Ankylosing Spondylitis Functional Index, and the Spondyloarthritis Research Consortium of Canada scores. Participants were assessed before and after sacroiliac joint injection and again after 3 months. So, what were the findings of this study? Well, 61 participants were registered in total. The results showed a significant difference between both groups regarding pain, spine mobility, SPAR-C, and ASDAS scores, in favor of the group that received the lidocaine and triamcinolone injection. Spine mobility showed the earliest improvement, followed by pain, while SPARC and ASDAS scores demonstrated improvement after 3 months. It was also observed that higher disease activity, younger age, and shorter disease duration were all associated with better outcomes. However, bilateral hip involvement was a predictor of a poor response. In conclusion, the study suggests that sacroiliac joint injection of lidocaine and triamcinolone in axial SPA patients is a cost-effective and practical technique for controlling pain, improving function, disease activity scores, and bone marrow edema with acceptable complications and a relatively sustained effect. This breakthrough study by Dr. Ahmed Elsaman and his group represents a beacon of hope for axial spondyloarthritis patients, promising a more comfortable and pain-free future. The world of medicine continues to evolve, and with it, our understanding and control of conditions like axial spondyloarthritis.